Okay. Hi, and thanks for joining us. My name is Dustin Zick, and I'm a member of the Children's Wisconsin Communications team. You're joining us for another one of our live question and answer sessions. Today, we're taking a little bit of our time to talk about what Children's is doing at our primary care and clinic locations in order to keep you, your child, and our staff safe and healthy in response to COVID-19. I have two guests, well, actually three guests with me today for this discussion. We have Dr. Kristin Bencik, one of our amazing pediatricians, and Laura and Noah Beres, patients just like many of you who will be sharing their recent experiences at some of our locations. As always, we will be taking questions throughout this video, which we'll be answering at the end of it. So please feel free to leave a comment with your question. And if you're not watching us live, you can still ask questions and we'll follow up in the comments afterwards. So to get us kicked off, I'd like to introduce our guests. Dr. Bencik, can you tell us a little bit about yourself?
Hey, my name is Dr. Bencik. I am a primary care doctor at the Bayshore Clinic in Fox Point. I'm also the mom of four, and so I'm really excited to be here today and talk about the job that I love and taking care of the kids that I love.
Fantastic. Laura, thank you so much for joining us with Noah today. Can you tell us a bit about your son Noah and the services that he receives at Children's?
Hi, yeah, thanks for having us. I'm Laura, and this is my son Noah. He was born at 27 weeks and has quite a complicated history, and so he sees a lot of friends at different clinics. We have our pediatrician at the Pewaukee office, and then we see PT, OT, speech, a lot of other friends at the New Berlin campus. And so we are there quite often, and we look forward to sharing our experience.
Fantastic. Thank you so much. So I'm pulling up a picture here. This is the first photo that you shared with us of Noah while we were looking for one of our patients to join us for this live stream. And while Noah himself is under 2 years old and he's too young to wear a mask himself, it's great to see him getting familiar with them since universal masking is one of the safety changes we've implemented. Dr. Bencik, can you tell us a little bit about that?
Sure. So everyone coming into the children's system is required to wear a mask. For kids like Noah who are under 3 years old, we don't expect them to wear a mask, though if they want to, we definitely encourage it. And I think it's important to kind of prep your kids because this is a different world we're living in. And these masks can be a little bit scary. And for the kids under 3 or the kids who are sick, we're going to be in what's called that full PPE. So that means we're going to have either goggles or a face shield. We'll have a N95 mask on with generally a mask on top of that. And then we'll be wearing a gown too. And so just to kind of, if you can prep your kids for that, especially if you're a little bit like the age 3 to 4 year olds, just kind of give them a hint. Because we do look a little bit scary, but we are the same people underneath. But it's really important to help prevent the spread and to really promote everyone's safety, the patients and the staff.
Laura, can you tell us a little bit about your experience with masks that led to Noah's thorough inspection of them?
Yeah. Noah likes to invest in everything, as you can see. He was not okay when we first went to our first in-person appointment after COVID started. I knew I had to just make it fun. He was used to staff wearing like the surgical masks from his inpatient stay, but mom was not supposed to wear a mask. And so he seems okay with the staff, doesn't seem fazed. But I played peekaboo with him. And so I would have my mask on and we would play peekaboo before I even took him out of the car. And so once he kind of would laugh at it, then I would leave it on and unload him and we'd play it a little bit more in the stroller before we would go in. And I think that he kind of hopefully thinks it's more of just like oh, funny, mom's behind that instead of something scary, because I know some kids maybe are a little bit scared by it.
Yeah, well, it's important to get him adjusted to it. And he seems to be very hands-on with everything in the best possible way. So another step that we've taken to help keep everyone safe is expanding our already stringent cleaning processes. Dr. Bencik, I'm hoping that you can talk a little more about that as well.
Sure. I mean, at Children's, we've always focused on having a very clean environment for our patients. But with COVID, we really had to step it up to try and help prevent the spread. And so we are doing intensive cleaning after every patient. We also are letting the room sit. And so because of that, we've kind of decreased the amount of people that are coming in so we can maintain that social distancing. And we're letting rooms sit in between patients. And then there's hand sanitizer everywhere. So we are really doing our best. I actually feel the safest at work than I do even going out and going to like the grocery store or other stores, because we are doing such a great job of really keeping everything clean.
Laura, what have you and Noah noticed about cleaning at our facilities?
I was so impressed. My initial fear with all of this was, how am I going to keep my medically complex kids safe and keep us safe as parents? And immediately when we would enter the clinic, someone was waiting with hand sanitizer. They, like the picture shows, they were ready in their PPE. They were very welcoming, which always helps. And there were sanitizer self-serve stations all throughout the clinic. Which just, it reinforces, and they've made it fun with the little characters for the kids. And so I think it's just nice as a parent to be able to keep getting that sanitizer if we're touching doors or anything. And it reinforces that safety.
Okay, yeah. And so as you mentioned, we do have our COVID Conquerors characters at all of our locations. So these are characters that we brought forth to kind of help express to our patients and their families some of the core things that we're doing in response to COVID. Another of those initiatives is physical distancing things that we're implementing. So this is a photo from one of our New Berlin locations that helps enforce that physical distancing and showing things about that, including these stickers on the floor as well. Dr. Bencik, can you tell me a little more about how that's being executed?
Yeah, so as you'll see in the picture, we have these 6 feet apart stickers, which kind of helps tell family members how to maintain that social distancing. We also have plastic barriers up at the front desk, and you'll notice that the waiting rooms look different than they used to look. We don't have as many chairs out. The chairs are strategically arranged so that if the families do have to wait in the waiting room, they're able to maintain social distancing. But all of our clinics are trying incredibly hard to get the patients back very, very quickly, so we don't have a lot of waiting time together with other people. And finally, for those facilities that have to use an elevator, we are having only 1 family per elevator. And depending on the complex, you might also have a greeter who will actually work the elevator for you, so you don't even have to touch the buttons. And so we're doing the best we can to really maintain that important social distancing and really to help stop any potential spread.
So Laura, switching over to your experience with Noah, can you tell us 1 or 2 things specifically about your most recent visits that you were most surprised with in terms of our precautions that we've taken?
Sure. We go often, several times a week for therapies. And so prior to COVID, we usually would be in a waiting room with a lot of other families. Like Dr. Bencik said, it's almost like the waiting rooms are just this non-existent need anymore, because they've been so prompt about, this is your appointment time, we're ready to take you, and just taking you right to your room and getting started right away. For our therapy appointments, they're kind of scheduling them staggered enough that if you come 5 or 10 minutes early, they've had the time to clean already and they're ready to take you, so that you're not standing around or sitting around waiting. They greet you right off the elevator, and it's been really nice.
Great. So one of the most important steps that we've taken are health screens for both our caregivers, patients, and employees. Can you tell me a little bit about that, Dr. Bencik?
Sure. So you're going to get a phone call before your visit asking some screening questions. And those are the basic screening questions. Have you been exposed to anyone with COVID? Do you have any symptoms of COVID at this time? When you are roomed, you're going to be asked those questions again, because we're really trying to really make sure that everybody's protected. And then the other thing we're doing, as you'll see in the picture, is we are screening ourselves to make sure that nobody's sick who's working comes into work. And so every day employees are screened for temperature and for other symptoms. So it's all around, it's about asking the right questions. And we ask as patients that you make sure that you tell us honest answers so that we can take care of everyone in the best possible manner.
So a few weeks ago, we did another live broadcast with Dr. Michael Gutzeit, our Chief Medical Officer, talking about our approach to testing for both patients, employees. Laura, can you tell us a little bit about the pre-screening process was like for you and Noah, along with some of your experiences around testing?
Sure. With his appointments, we get a courtesy call with those reminders of symptoms, seeing if we've had any exposure, any contact with anyone who's been tested positive. And so that's just, it's kind of nice to just know that they're really focused on this patient safety and making sure everyone's okay. Noah recently, now twice, has had his COVID test done. And everyone does such a great job of making it feel safe and caring. Even though there's a lot of PPE involved, he's had it done in the ED, and then today we had to do it in the drive-through at Children's. And everybody takes the necessary precautions. Until we know he's negative, we're going to assume he's positive. So like Dr. Bencik said, with the gowns and different masks and different protective equipment, and it just makes me feel like his best interests are in mind. Because they want to make sure he's safe and everyone else is safe too. Yeah.
So one of the last significant steps that we've taken in response to COVID-19 is in regard to some visitor restrictions. Can you remind us what those are, Dr. Bencik?
The most important one we're doing right is only one caregiver per patient. And we understand how hard this is for families with multiple children, or for newborn parents, or kids with complex medical conditions like Noah. It's hard to travel with a lot of stuff. But the reason we're doing that is you decrease the number of people coming in, you automatically decrease the risk to other patients, the risk to staff members. And so we're really trying to do this to really help keep everyone safe again. Safety of our patients and our staff is our number one concern here.
Absolutely. And we know it's a policy that weighs heavily on many families, which is why we're constantly reevaluating it on a rolling basis. And if you're interested in learning the status of our visitor restrictions or any other responses we're taking to COVID-19, we certainly encourage you to call ahead before your appointment and talk to a member of our staff. But you can also visit our website at the URL displayed on the screen here, childrenswi.org/safety, which you'll find the most up-to-date information about the safety precautions we're taking in response to COVID-19. Before we check to see if we have any questions from our viewers, is there anything that either of you would like to share still? Dr. Bencik?
Sure. What I want to say is I just want to remind everyone that your doctors are here. And we're ready to take care of you, and you should not be scared to come into the office. Please, please, please do not delay treatment because you're worried about coming into an office or the hospital. That is so important. We are doing everything possible to mitigate the risk, and you are safe here. And the urgent care, the ER, and your primary care doctors are all here to take care of you. If you have questions, call us or use the MyChart option. We will tell you which way to go, but please don't delay your care. That's so important that we keep our kids safe with all the normal preventive measures that we normally do as pediatricians.
Absolutely. How about you, Laura?
When Noah first came home, it was the end of January. And so we were so excited. He'd been inpatient 353 days. We were so ready to be home and we were going to do things, and it was exciting. And then it was 5 or 6 weeks later and COVID hit, and it's terrifying. I'm sure as a parent of a healthy child, and even more so as a parent of a medically complex child with respiratory needs. And it took a lot of telehealth Zoom conversations with his therapist and his pediatrician and his pulmonologist to to understand and then to know what's being done. And once I really felt comfortable was when I was talking to his OT and she said, this is what it looks like. You walk in, and she literally walked me through step by step of the precautions and what that meant. And she literally described it exactly as it was. And it was so reassuring. I like to know what to expect. And with only one parent coming with him, it's not easy to have anything unexpected show up. So I knew as soon as she was explaining this that in therapy, there are only maybe 2 or 3 kids in the whole studio because they want to keep them so far separated. And it's amazing. And he really does get his own little world in the therapy office, and it's safe and very clean. And I have no regrets of going back to the clinics. I feel very comfortable, even given all of his needs. So I encourage families to talk to providers and make sure that you too can feel that same comfort level to get care for your kids.
Absolutely. Well, we are so grateful that our message has came through and that you have had such a positive experience with Noah and that we're able to give him the care. I don't think we've gotten any questions. So thank you all so much, Noah in particular, for being the star of the show here. We really appreciate you, our audience, for taking the time to watch with us today. If you have any questions and you weren't able to leave them during the live video, again, we encourage you to leave a comment. Or you can reach out to your doctor or call our nurse helpline or visit childrenswi.org. You can find information about the safety precautions we've talked about today, blogs about how to talk to your children about COVID-19, and so much more content there. And please remember, if your child needs medical attention, we are here. From our telehealth options, such as children's online urgent care and the steps we're taking at our physical locations that we talked about today, we're doing all we can to keep you and your child safe, as well as make it through COVID-19 together. So thank you so much. Dr. Bencik, Laura, Noah, thank you so much for joining us.
Thank you. Bye-bye, everyone. Bye, Noah.
Bye.